I've seen plenty of patients come in with severe pelvic pain, and they're just, they've been having chronic pelvic pain for years, and, hasn't been diagnosed, and they finally come to see our doctors, and they're send them in for the ultrasound, and lo and behold, there's a cyst. The doctor sees the cyst on the report, and then they get to tell them, well, you have a cyst, that's why you've been having pain. And they're like, they just feel so validated. Another example would be the patient who's been working on their weight, they're feeling good, they're eating right and doing all this great stuff, they're feeling thin, and they're like, but here in my abdomen I just feel this, I'm doing crunches and it's like there's something in the way. They come see the doctor, and they're like, the doctor feels this mass, and some of their friends are remarking that they look pregnant, and the doctor sends them in for an ultrasound, and they have a big uterus, or they have a big fibroid above the uterus, or a big cyst. These are big things that, are way up high, and once the doctor can remove those out of the uterus or help them get rid of that, they're flat tummy. The AIUM accreditation, this is an accreditation process that they started actually long before I came here. What it is, it's a whole lot of things. It's saying that we, take good care of our probes. We do, they're cleaned at a certain interval, like after each patient for a certain amount of time, and that our machines are checked for calibration by an outside source and calibrated. We also send in lots of pictures of the first trimester, second trimester, third trimester from all of our sites, and all of our sonographers, all the doctors have to sign the reports. It's like we want a broad spectrum of what the work is like that's being done here. I think the most rewarding part of my job is, being a part of the moms and dads and the entire family coming, and they come back again and again to, have these different babies. They have one, and then they might come back 5 years, or they might come back the next year, but they come back, and just to be part of that memory, and they're like, I remember when you did this, and they remember this crazy detail. But that's why it's so important, I think, to, just be on your best, and just, I just know I'm part of that memory. So that's kind of keeps me always in good spirits, that I know I'm about to create another memory for somebody. So it's just really, that's the first part I think that I can think of. But it's just great to be here and be in this great, community, and work with the great doctors that we have. But there's just so many things I could probably go on and on. But that's probably the first thing.